Sunfert is amongst the first in Malaysia and probably amongst the few first initial user of what we call this next generation sequencing platform for PGT. PGT is a big umbrella. It covers PGS, that means screen for chromosomally normal. Essentially, we do this screening for embryo selection. The next is PGTM or PGD, that means pre-implantation genetic diagnosis, what is called before, but now it's called pre-implantation genetic testing for monogenic diseases. Now, these are inheritable diseases such as thalassemia. They are single gene disorder. So over here, what's special about us? We have cardio mapping. Again, this is a platform differences. Cardio mapping is able to give us a one platform testing for both PGTA, which is a chromosome, as well as single gene disorder.
We have a few new technologies in the lab, and one that actually stands out the most is actually the use of piezo-ICSI here. So what is piezo-ICSI and why is it so special? It's because that in conventional ICSI, the needle is actually pointed and it's sharp. And for piezo-ICSI, it's actually rounded. Imagine a pointed edge. When we do the insemination into the egg, it's actually injuring the egg more. So when it is rounded, the injury is less to the eggs. So we actually get higher fertilization rate and also lower degeneration rate from there. One that is quite new right now is artificial intelligence. So we are looking into AI. So we have three types of AI. We have something called viability AI, genetics AI, and time-lapse AI. So viability AI is basically looking at the how viable a blastocyst is to be used for transfer. And genetics AI, it predicts euploidy. Euploidy means that if this blastocyst is normal or not. What is the chance that this blastocyst is normal? And then time-lapse AI, it actually looks at the development of the blastocyst and predict if it can implant or not. So all three of this, it plays a role in selecting the best embryo for transfer.
We have launched a new test currently, which is a non-invasive test, affordable, and will improve our success rate further. It's known as the fertility gene code test. This test is basically, we just take blood from the patient and we analyze their blood and we look for the type of medications which are more favorable for them. Example, for fertility, there are many types of injections, hormones which are available. So that test can tell us exactly which type of hormone injections to give and which we should avoid, and which will make the patient to overstimulate. Secondly, that test also will tell us what the genetic issues that they have, which may cause problems for them to conceive, or it may cause their babies to have the genetic problem. So hence we are able to advise them on what tests in future which they can do to ensure that babies don't have that medical problems.
So for TMC Penang, everything can be done here because we have a lab that is well equipped. The first step of your treatment, from starting stimulation, injections, from ultrasound scan, egg retrieval, embryo transfer, endometrial receptivity testing, for men with sperm problems who need surgical sperm retrieval. Even for our latest technology that we are doing now, that is the ovarian plate-rich plasma therapy, PRP, also is done here. For couples who wants to come here, it's just like a one-stop center, so they at least have a peace of mind when they are undergoing treatment, that they come here and everything will be taken care of, rather than they have to go to different centers to get things done.
I often describe the doctor-patient relationship as a partnership. And I think that nowadays, technology is probably similar, if not the same. So I think the main difference that we would talk about is to find a team or a doctor that you feel comfortable with, that you will partner with through your journey. That is very important. Fertility treatment is a very, very emotional journey. And I think that if you find a team or a doctor that understands how emotional it can be and you get enough support through that journey, it is just as important as the higher end technology that you can have to get you pregnant. We actually don't pay enough importance on how stress affects all of us. And sometimes it's not just workplace stress, it's the stress of getting pregnant itself. Having a team that you believe in, having a doctor who believes in you and who's willing to go through that journey with you, I think that's very, very important.